Good morning. My name is Joan Delabreau. As many of you know, I'm the chairperson for the Menominee Tribe of Wisconsin, or specifically the Menominee Tribal Legislature. I wanted to come on and do a podcast for our membership because our tribal legislature has done a lot of things, and that somehow we've kind of been silent. And the purpose of it has been because we have instituted, with a declaration of emergency, an incident command system. That does not mean that the legislature has been absent in any of the decisions that have come forward. The legislature is very concerned with COVID-19, and their goal is to, number one, keep our membership safe, especially those who are at risk, and provide the services that they need to be safe, and to assure that membership that we have a very credible and qualified incident command team that has been set up. We have Dr. Slagle, who many of you know is the medical director for the Menominee Tribal Clinic. She's been here for a number of years. She is our public health official. We have Ben Warrington, who is the emergency management coordinator, who leads this team. There are other individuals. Some members of the legislature are assigned to assist because of their qualifications and their experience with incident command. We all know that this COVID-19 is spreading very rapidly and has caused a great deal of uncertainty to our tribal members. It's no different from us as on the team and the legislature. We are reacting as fast as we can to try to address situations so that services are not interrupted to our membership. And we, as many of you may have known, that with the declaration of emergency, that incident command structure will take precedence over getting information from the doctor out to the public, and information that has been coming out on behalf of Menominee Tribal News to membership. We also understand that some members are struggling because they don't have internet, Wi-Fi, a smartphone, and how we get that information out to you. We've been providing it with the food for Meals on Wheels, but we are currently looking at other ways so that all our membership on the reservation is informed, and even trying to reach out to those who are not on our reservation, which is about half of our population. So if you see a link to register to get this information, please use it, because that incident command team are putting out excellent information. As I mentioned to you, that the representatives on our incident command, we have 4 members of the legislature who are involved in that. As that team may expand, as this virus gets closer to us, we may have to institute other levels, but know that that incident command is taking all of those things into consideration. We know the closest one to us right now has been Brown County. I think many of you are aware that a tribal member from Red Cliff was affected. We have no reports of any incidents of positive tests with the Menominee or on the Menominee Reservation at this time. As the virus gets closer to us, those will be other trigger mechanisms that will demand that incident command do some other things to their ability. They're also working close with administration, because we all have a lot of employees, Menominee Tribe employees, about over 800 individuals, and we're trying to take care of those individuals as best we can, but also reaching out to the charter entities, because they have a lot of people employed for those. So there's a great deal of cooperation. County's also involved and has been involved with our incident command team also. For the last 2 weeks, tribal leaders have made decisions on specifics and immediate actions to be taken in reference to COVID-19 pandemic. We have been working with the clinic personnel. As I mentioned earlier, you may have seen that there's tents that are in place. They are triaging individuals who are sick to make sure that they get priority to see the doctor. They are asking for individuals to call in for medication, and they will deliver medication to you. Some of the routine care has been stopped. And so I ask you to exercise patience as you go to the clinic. They are trying to meet the needs of our membership down there. But there will be doors that you will be restricted to go through now with a registration person. Most recently, last night, the legislature, we did have our meeting, and I'm sorry that attendance is restricted to 10. That's a direction not only from the state of Wisconsin, but also our own medical team. We are hopefully, if this prolongs, we're looking at exploring some kind of live feed of the meeting so that we can keep you informed of our legislative meetings. But we did meet yesterday. There was an order made to close all non-essential tribal government operations per the administration policy that was created. I had hoped that I would have that information in front of me so I can say this facility is closed, but you may see cars there like our Gordon Dickey building or the Fick building. It is open to staff, but it's not open to public access. So you will see cars there, but please don't try to go there. We're asking for, like with license and permit, that you mail in your registration. Child support has a skeleton crew there so that child support payments for some individuals can be processed. So that's what we mean, is that the building may be open to staff, but it's closed to public access. That list will be made available with a public release that's going out to be more clear, but also understand that as we progress into this pandemic, that there will be more changes to that list as this moves forward. Under the temporary policy, all non-essential tribal government services and facilities will be temporarily closed and cease operating as of February 20th, 2020 through April 3rd, 2020. There's nothing magical about the 14 days. It may roll over for another 14 days, and of course we will keep you informed of that. We're trying to work with as many people as possible to telework from home. If you are deemed non-essential, steps are taken to ensure that if we can't find work for you, that you still will be paid for a period. The legislature's intent is to take care of as many people as possible at this time. And the tribe is, in that effort, is trying to provide the essential services that members may need. We are very appreciative of the tribals or the MISD for providing meals to our children. We're appreciative of the Elder Center, who is providing meals to our elders. As things move forward, there still are other services that will be going forward, like the delivery of your prescription for elders through our community health aides or the public health nurse down there. We want to take steps to keep our elders safe and restrict their movement because, as many of you know, the individuals that are at risk are your elders, someone with a compromised immune system. I think they've targeted people who are diabetes because you are compromised in that fashion, and others. So as we move forward, I stress what we hear from Dr. Slagle. Please practice social distancing, keeping 6 feet apart from individuals. I'm sorry to say, with my film crew here, they're not 6 feet from me, but they're young and they're robust, so I'm not too worried. But practice good hygiene, wash your hands frequently, and also use the sanitizer that has a higher volume of alcohol of 60%. I want to especially thank and express my thanks to deep appreciation to our incident command team, who are doing an excellent job. I can't stress that enough on behalf of the legislature, that without them, many of these things would not be taking place. And they are doing one phenomenal job on our behalf. I also want to stress that Menominees are a very resilient people. We have been around for a number of years. We've gone through a number of hardships, and we have endured. And I think that in this case, we still will. Nothing's going to defeat the Menominees. So I thank you.